This episode was recorded live at SmileCon 2023. Enjoy. Hi, y'all.
Hello.
Hey.
Hello, everyone.
Super excited to be recording in front of a live audience today.
Very, very exciting and very exciting episode.
Yes, very, very exciting
we are
episode.
going to have a Halloween treat for our listeners.
Yeah.
We are going to approach some creepy, scary, and very difficult situations and stories from practice.
Yes.
So we are going to talk about this, and let's see how practitioners handle these creepy situations.
The scary stuff, the
Scary
patients
stuff.
that make us
Scary,
crazy.
Scary and
Yes.
unpredictable. So I'm Dr. Effie Ioannidou, and
I'm Dr. Arnell Wright, and this is Dental Soundbites.
Yay.
Let's get into it, guys.
Love
Ooh, I love the energy. All right.
From the American Dental Association, this is Dental Soundbites, created for dentists by dentists. Ready? Let's dive right into real talk on dentistry's daily wins and sticky situations.
so this is supposed to be an episode that I think it's a fan favorite, right?
Yes, yes.
So we are diving right into the sticky
Yes.
situations and the scary stories. So real dentists, real stuff. That's not fictional. This is all very exciting because we are recording in front of you guys,
Yes.
live audience. And this is the first for us. So we really, really love it.
And you know, I'm going to go ahead and welcome our guest today, Dr. Simone Ellis,
Hi,
who
lady.
joined us all the way from Texas.
Houston, Texas,
Yes.
y'all, right?
Dr. Ellis, hello, hello. Please tell us a little bit about yourself.
Well, thank you guys first for having me on. I'm excited to be here with these ladies in the pink. Aren't they Barbie fabulous, right? Like, let's get into their
Yes.
outfits.
Hi, Barbie.
I love it. I love it. But I'm from Houston, actually born and raised from Kansas City, Kansas. I
Wow.
don't think that they thought this country girl would make it that far, but she is
Yes.
now in Houston, Texas.
Yes.
I practice 2 days a week in my private practice at Missouri City. It's called Smile Design Studios. And I have done all of the things. I have a podcast myself
Yes.
called Beyond the Chair.
Beyond the chair.
Which is, what do we do as dentists outside of the chair to become amazing individuals, right?
I
Because
love
we think
that.
about it, we sit and we serve, but what are you doing outside of the dental chair to become an awesome person?
Yeah.
And I think that that's important. I also have Smile Design Society, which is a membership group.
Okay.
That is for doctors to talk about all things clinical. How do we become amazing providers?
Yeah.
And the last thing that I do is I do coaching.
Okay.
I have some amazing doctors that we're really working on how to build life first, work second, balance third. So my goal is
Ooh, I
all of
love
these.
that.
Yes.
That was
Oh, I
big.
love this.
Because
that was big.
come on, guys, like we are people
Yes.
serving these teeth, but if you're not whole,
Yes.
it really makes the industry a lot harder. So that's what I do.
Yes. Oh my
my
gosh.
gosh.
Yeah.
We definitely have to connect on that one.
Thank
I
you.
love it
This
so
is
much.
great. So you practice 2 days a week.
So I went from 6 days to 4 days to 2.
Wow.
And I figured if I could be efficient in systems and strategies, that I could produce the same amount of money that I was doing in 6 days and 4, and then 4 days and 2.
Wow.
And so when I am
Brilliant.
in there,
You are working.
I am in there. These
You're
are $20,000,
working.
$30,000 days that I have
Wow.
because I'm like, I got to get it done. So like,
Yeah.
my goal is not to make it easier, but become more efficient, more streamlined. So that
I
was
love
what I
that.
did.
That's great.
Yeah, so I'm Tuesdays and Wednesdays in the office, and then, as you guys know, creating content, that's not easy. So
No,
Clearly.
not at all.
right? So that is a Monday, Thursday job. And then
Yeah.
on Friday, that's for your girl. That's
Nice.
for me to like do all the spa things and all the cute things and relax, get into
Yeah.
my own space.
Yeah.
So that's my life. Yeah.
I'm jealous.
I am.
I'm jealous of
Yeah.
your life.
No, it's just a system, right? It's just
Yeah.
a balance. We just create the strategy and make it executed.
Yeah.
I love it.
So
Well, this is a topic that we come back to every single season because we really love all of the feedback that we're getting, and you all who are our listeners, y'all really love sharing, y'all love hearing all about these sticky situations, the weird things that we as dentists, we've all gone through.
Yes.
So I cannot wait to get this party started. Dr. Ellis, we're gonna just put you right on up.
let's go.
First,
Let's talk about the crazy
Yes,
and the
let's
scary.
talk about
Okay?
it. So can you tell us one of your sticky situations or any horror stories that you've experienced in clinic?
Oh my God, where do we begin, right? I think
Yeah.
like walking into the clinic, it's just scary sometimes as a whole. Like you never know what you're going to get. It's like a Cracker Jack box.
Right.
And I'm like, what's the surprise that's going to happen today? So, I mean, I've had the stuff that's been as crazy as dental terrorism, right? You guys know these patients that come in there and like, they're going to rule the whole entire office, and the day you see them on the schedule and they're just like, I don't want to see that person today, right? The people that have...
This is real.
This is a real life
so
stuff,
real,
right?
you guys.
The people that have decided on how they're going to come up with their dentistry and their dental plan the way that they want it to be, right?
Yes.
That's horrific for who?
Yes.
The dentist that has to provide it, right? The ones that get educated on ChatGPT, TikTok, Google, you name it. All of that to me is terrifying. And even the patients where my team cracks up, because I count teeth all the time. I'm like, is this 22 we're working on? Are we 22 or are we working on? We're working on 22 because God forbid the scary situation of you pulling the wrong tooth. God forbid the time that you work on the wrong tooth. So I think to me, dentistry is just scary in general, whether it's the patient that's stroking out. Have you had that? I have. I've had a patient in the chair have a stroke. You haven't had that?
No.
That's a classy day. What about the patient that had a seizure? That's happened. I mean, so these are all things that really terrify you as a provider.
And I think these things are more terrifying when they happen in a private practice setting.
Oh, God.
I practice in a hospital setting.
Okay.
So it's a completely different security space, right?
Yeah.
Like you feel anything goes wrong medically, you're there, you're in the hospital.
Correct. Private practice, and I started my own private practice 1 year out of dental school.
Oh, wow.
Right.
1 year out of dental school?
1 year. Like June of 2010, I had my own office. So all of the horrible stories that you could imagine happened
early
in the first
career.
year.
The first year. The first year was like, let's mess up everything. And I think that just not knowing what you don't know, even from the standpoint of when the patient had the seizure and you talk about these things in your morning huddles and in your meetings, and then when it really happens, you're like, oh my God, this is go time. Like I gotta figure out how to get myself, this patient taken care of, but also is my team okay? So it's just a lot.
That's really scary and very responsible.
Yeah, I think that those are terrifying. And then I think the other scary situations are my patients that go overseas. Oh, I love these ones.
Oh, yeah.
These are the ones that go in like, okay, I can't afford your dental work, and I've already told you what you needed to get done, and you go overseas and get something completely different. And then you're like, hey, doc, can you fit me?
Check it,
And I'm like, what is this? Like, I don't even know. I don't even want to touch this exploding bomb that's about to go off in your mouth. So that's terrifying too, because do you decide as a practitioner to take on or inherit a case that you don't know if it's going to put you in a sticky situation or not? So, I mean, I don't know. Dentistry can just be scary.
Dentistry is scary, and you have to balance between the responsibility that you have towards the patient. A patient with a problem that you feel that you have to treat, but on the other hand, as you said, you inherit someone else's mess.
And that is scary because you have no idea what you're like getting. I don't know what you put on that. I don't know what is underneath that crown. Like I have no idea. And then I'm responsible for this. Did I inform the patient ahead of time? Like, hey, I don't know what I'm about to see. When you're coming right out of school, a lot of times you don't tell the patient enough information, right?
Do you feel like it's because you haven't developed that skill?
Oh, definitely.
Like you haven't developed that language, developed that, like it's like automatic for you to think, to say, okay, this.
Well, with competence comes confidence, right? And so you're just not competent enough really because you're like, I'm just now getting out of school. I understand the basics, but I haven't had enough of these procedures to be competent in them. And so therefore, I can walk into a room now. I've been 14 years in the game, so my confidence is there, right?
Probably also the training that we get is not that much towards appropriate communication with the patient.
Correct.
It's very technical, but not advanced in communication. So you go out there exposed in the first year, and you're like so
okay,
where do I start?
What do I do? What do I do now?
And the lack of understanding your own personal identity is important, right? And it took me probably till year 6 where I went and had the opportunity to shadow one of the top cosmetic dentists in New York. And I got a chance not just to see him technically, but to see how he operated with his patients, his temperament, his flow. Now, this is an older white Jewish guy, right? So his environment, how he interacted with patients was gonna be totally different than this black girl from Kansas, right? But what I saw was his authenticity. What I saw was his ability to connect. And what it taught me is don't try to be him because he's amazing in his own right. Become yourself. And that also, I think, helps. You don't know how to be your own authentic self yet because you're just kind of figuring out
like
dentistry as a whole,
like
right?
how to be a doctor all together.
Right.
How to be a doctor, you know what I mean?
Yeah.
How to even be a leader, right?
Correct.
Exactly.
Yeah.
I mean, did you have any scary stories?
Oh, yes, I do have a scary story. So, one that comes to mind very readily, you guys are not going to believe this. So, like, you know how when you have a patient come in, you're doing an exam, and you're going to percuss a tooth to see if it needs endo. So I percussed the tooth. I told the patient exactly what I was going to do. The patient got irate. The patient ended up calling the cops on me. Yeah.
For touching the tooth?
You banged on my tooth with the mirror. And I was like, well,
call the cops?
So you were abusing the tooth. How dare you?
I know, yeah. I was like, but listen, okay, so the thing about it is I was 2 years out.
Oh, God.
That traumatized me because I'm like, is this what I have to deal with?
My
You know what I mean?
gosh.
So like, it keeps me on edge, even though I try, before I do any exams, this is what you should expect. I try to lay it all out, which still doesn't always work, by the way. It doesn't matter like how much information you give, you still can like fall short
of course
from a patient's, expectations. It's just that human piece, but it really traumatized me. I was just like, oh my gosh, like the patient called the cops on me. Like what's gonna happen? You're new, you think doom and gloom about every little thing. But yeah, a patient called the cops on me for doing a percussion test. So
crazy.
Oh gosh.
I have another one that was really good.
Okay.
Let me share this one. So I'm first out of school, right?
Okay.
And I am working at this office where he has a 10,000 square foot practice, right?
10,000 square feet.
10,000 square feet. So, I mean, it was every specialty you can imagine, like amazing, right? But he wasn't a great doctor. And I'm not just saying that because like I'm judging. It was really like, I would just go into the office and be like, I don't know what is going to happen. He was also not only sleeping with the patients, but sleeping with the team as well.
Yeah.
Right? Okay, so this is the drama, guys. You guys are ready for this? You guys are you into this story? Come on, I need to hear.
The juicy. Yes, they're into the juice.
All right, it's crazy, right? It's going.
Y'all are into the juice.
Right.
Okay.
So,
First class
and I'm sitting here, I'm just out of school. This is why I opened my office a year out, because I was like, I can't go through this. Is crazy.
No, ma'am.
So all of a sudden I hear, what is going on? And it is this husband of a patient that I've been sleeping with coming into the office in the pedo department and destroys the whole pedo section.
Oh,
I mean, when I tell you, it was like the scariest thing to be on that side of dentistry. While there were pedo patients there, this was like horrifying. It was Mari Povich. Like it was
That's
Jerry
like
Springer, right?
Jerry Springer, yes.
Completely. That's like live TV.
I could not put in my notice fast enough, guys. Like I was like, this is crazy. The office got shut down. I mean, it was wild, and I was like, this can't be dentistry.
Right. Yeah, it's hard to hear, but it's like grateful. Like I don't know. I celebrate sometimes when proper treatment happens or whatever, because our goal is to take care of our patients.
Of course.
You know what I mean? So
there are scary, really scary situations you can face. I remember first year out of residency.
Okay.
I had my own practice. I was like super confident. I'm rolling the world. I know
love
everything.
it.
I can place implants left and right.
Eyes closed.
So yeah. So I'm supposed to place an implant on missing 27. Took all the X-rays, studied the area. Mental foramen is far away.
Right.
Straightforward case. Plenty of bone.
So we thought.
Yeah. Everything was perfect. Textbook, right? Reflect the flap, everything's going great, place the implant, and then I take a PA after the surgery. No issues with the patient, everything went smooth. And then at the PA, I see a radiolucency at the apex of the implant. And I'm like, where is the mental foramen?
Yeah.
Where is it? Was it there or here? What happened? So I go to the pan, I see that it was between the premolars. I'm like, what the heck is this?
Yeah.
So I still played cool, of course.
Right. Yes.
Cold sweat.
Yes.
And I said, when you go home and you recover from the anesthesia, call me, please. So they called, they were fine. To this day,
You don't know what it was?
It was not the foramen for sure.
That's crazy.
But oh my God, I lost.
You were freaking out.
Oh,
You're still talking about it.
I was like, you should never be that
been.
confident.
Oh my God.
Just always keep.
Wow.
Yeah.
And you still don't know what it is. It's still a mystery to this day.
No, mystery to this
Mystery unsolved.
Right.
Unsolved. The good thing is that everything functions. You know, we don't have
Yeah.
anesthesia. Everything works well. Lips are felt.
I love it.
Everything is great.
So, you
It
know,
was unbelievable.
very unbelievable. I was going to
Unbelievable.
say one thing that's really important to help some of our listeners is how we handle those situations. So, Dr. Ellis, we know that you, in one instance, you put in your notice real quick.
Real
You're
fast. Like,
out of
this is
there.
not for me.
And that's a way to handle a situation. Like, let's be real. That
Yeah.
is a way to handle a situation.
For sure.
And with your other experience, how would you recommend for listeners to handle sticky situations if they're ever in something like that? And Dr. Effie, you can
Yeah,
comment on
yeah.
that too.
Well, I think that a lot of times as doctors, we get very focused on doing the work, but not the training, the team.
Love it.
Right?
Okay.
So
Oh, I
that's
love this.
I think that's
Up my
important,
alley.
right?
Yeah.
We got to train the
Yes.
team properly when those sticky situations happen,
Yeah.
right? So the patient or the assistant, if their face is sweating, blood, sweat, and tears, right, while something is going on, that's alarming to the patient, right?
Yes.
It really has to be a flow as far as when we get ourselves in situations where we're like, I don't know what the next step is. What does the team know to do as far as their responses,
Yes,
right?
yes, for
So
sure.
have conversations in morning huddles, have conversations in your team trainings to know, hey, if we have a patient that has a seizure, what is going to be our standard
What's the
protocol,
protocol?
Yeah.
right?
Correct.
Yeah.
I love that.
Yeah. So I think that that's really what I would say is for the most part. And then for doctors who are uncomfortable with procedures and things that maybe make them uncomfortable, like become competent. And how you become competent is through training.
Training.
Yeah.
There you go.
Yeah.
And refreshers.
Yes.
Refreshers of
Oh my God, if
training,
we're
right?
not students of learning, like, I
Yes.
mean, we're here at SmileCon, like, I take learning so seriously.
Yeah.
It's a thing,
And
right?
I love
Yeah.
that. Even after 14 years of practicing, I just want to give you all the flowers. Like, I love that.
Thank
Yeah.
you,
No,
thank
for
you.
sure.
I mean, we gotta be
100%.
hungry, right?
Yes.
Technology is kicking our butts left
Yes.
and right.
Yes.
I gotta
Yeah.
beat it at some point. We gotta
Yes.
beat, yeah. So you gotta
Yeah.
train for sure.
Anyone can listen to Dental Sound Bites, but we have a secret just for ADA members. You get access to exclusive bonus content in the ADA member app. Unlock it today at ada.org/app.
Let's be honest, networking events can be intimidating. Lunch meetings can be awkward. Now, you can connect with dentists from anywhere using messages and calls in our ADA member app. Download in the App Store, Google Play, or visit ada.org/app.
I hear we have some guests in
We
the
have
audience.
guests.
Yeah.
love
All
it.
right. Who have some chilling stories to share. So we do have a microphone right here. Where is Dr. Mike Giuliano? Hey. Come on up to the mic. Can you please tell us your story?
So my name is Dr. Mike Giuliano. I practice in Chicago, Illinois. I graduated from UIC in 2021. So let's take you back to when I was in school.
There you go.
I was a D3, and you're getting into your cases. You're feeling a little bit better. You're working up on your confidence a little bit. And so I'll never forget this story. At UIC, we have operatories. And so, you can kind of see in, see across. Our faculty walk up and down the halls. And so I have a patient. I'm working on the lower left side, a couple fillings, number 19, number 20, straightforward stuff. And I'm getting ready to finish up, and this patient's amazing. And I'm going in there, and we don't have assistance. So I got the slow speed evacuation hanging out the patient's mouth.
Right.
I'm trying to block the tongue, and filling's pretty much done. I got to go in there with like a little polishing tip. Okay, so safe, right? As you would assume. And so I'm blocking the mouth. Well, I had been polishing, and this patient swallowed. Floor of the mouth came way up and over. I still have yet to see this in my couple years since, and I'm glad. But came over number 19, and that tip got wrapped up in the floor of the mouth.
Yeah.
Naturally, I didn't realize how big of a deal it was at first until all of a sudden there was a lot of blood, and it wouldn't stop. And so I'm grasping at, the gauze. I got the slow speed. I'm trying to, again, you guys mentioned it before as well, trying to keep that cool face so the patient doesn't really understand exactly what's going on so that I can get a faculty over. So I managed to flag one down, and then, naturally we went into the perio department. We got someone to suture it, and all turned out all right. So, but I'll never forget it, and I'm glad I made that mistake in dental school, and we learned from it, and we move on.
Yeah, and you mentioned something so great, that you learned from it.
Yeah.
I wouldn't even call it a mistake. I would call it a learning opportunity. Yeah. You know what I mean? Like, what would you guys say?
I would say that thank God that there are periodontists
around.
Exactly.
I know, thankfully.
That's the periodontist, by the way.
I know, you guys are live.
Good plug.
No, I completely agree.
Yeah.
It's an opportunity. I think it was the right moment for you to learn, to have this experience in dental school.
Yeah.
So, if something like this similar happens the first year you're out, you've seen it. You've seen what they did, and you know how to stop the bleeding.
Yeah.
So that's perfect.
Yeah, so that's my story.
Not that perfect for the patient, but perfect for you.
Yeah. And Dr. Simone, what are your thoughts? Because you have an associate, right?
Yes.
Like you have been there to help, situations.
Oh yeah, she breaks teeth all the time. I love her.
Right? Yes.
I know she's somewhere here, but I mean, we're just that's what our responsibility is that as the associate, the mentor to the associate. That's what I consider it. It's not just. You're not just doing a service for us. Like, I gotta guide you. And so I think for the scary situations, those are the ones that you never forget.
Yes.
You always remember, and like you said, you're always empowered to do better by that, right? Like,
for sure.
I count teeth because I saw one of my colleagues pull the wrong tooth.
Yes.
Yeah.
And forever in a day, I'm like, 21, 21. Are we working on 21? Are you sure today is 21? Or cutting the tissue? Like, who hasn't done, like, who has not cut?
Oh, everybody.
Yeah.
Oh,
like, who hasn't cut somebody?
I mean, the tissue just gets in the way.
It's just annoying. It's like, why are you there?
In the way.
Why are you there, tongue? Why did you need to be there? You didn't ask for that tongue to be there in that space, right? So disrespectful. Like, the audacity of that tongue,
I have to admit that there are some people that have so powerful tongues, right?
What is it?
You're trying to retract.
And then they oppose you, right?
You just know they're cussing people out all the time. And like, they're just, that muscle is always moving.
God, this drives me crazy. I'm like, relax your tongue.
Like, relax.
And they resist.
Oh my God, the cheek. No, I love the masseter muscle, the one that's like really tight. Not only I'm pulling here and I'm pulling here. Like, I didn't work out today, guys. Leave me alone. Like, I'm not that strong.
Sometimes you do have to eat your Wheaties.
Yes, I agree. So
I think we have one more story, right?
Yes, we do.
Dr. Britany Baker.
Where are you, Dr. Baker? Come on down.
Hello.
Hey. Tell us your story, Dr. Baker.
Okay. It's a little bit crazy and bizarre.
We love crazy.
That's what we love.
All right.
And that's what the audience loves, right?
All right. So basically, my patient came in for a limited exam, never met this patient before. The assistant was taking the chief complaint, and the patient believed that they were part cow. So cow, like C-O-W, cattle. So claimed that half the DNA in their body was part cow. Dead serious.
I can believe that.
Which is like funny. It's like funny to laugh at, but then whenever you're there and you're at work and the patient's paying to be in the chair telling you that they're a cow, like, what do you say?
Right.
So
did they start
basically,
mooing? Like, at any point, did they just start mooing?
They
I
didn't.
just expect
They didn't.
that.
But they were kind of explaining. They were saying, all of the men in my family, whenever someone is birthed, we go out to the yard and we graze on grass. And the patient had very large buccal exostoses, lingual tori, and they claimed that their previous dentist had cut off their gums. They didn't have teeth before. But yeah, we still don't really know why this patient came in, what they really wanted. We were like, that's just really normal anatomy.
Yeah. But you know what?
Oh my God. All I was just thinking was, his mental health is a real thing.
Right. That's exactly where I was going to go with that. Is like, we see some strange things in our practices, and sometimes we're faced with like, what do we do? Do we proceed with this relationship? Do we cut it off? Like,
it's a thin balance, right?
Yeah.
It's a very
for sure,
thin
because you
balance.
have to take care of yourself too. Like when the wellness piece comes into play, like we have to take care of ourselves.
Yeah.
So
Oh my God, this is
I can't get it together.
Yeah. Well, moving right along. Caught that?
Good. That is good.
Right. Is there anyone in the audience who'd like to share a sticky situation or a story with us?
I see him back here. He's looking like, I see him. I see he wants to share. He wants to share. He's been practicing. He knows. I see it.
Yay. Good. Okay, so we have a sticky situation. Let's talk about it.
I saw it in your brow when you raised. You had some good stories.
Hi.
I've got a bunch of good stories. I practiced dentistry for 42 years, clinical practice. I've been retired for 4 years. My name is Kim Kutsch.
Okay.
I'm from Albany, Oregon.
Kutsch, okay.
As you were telling these stories, I was young in practice, and I had a family of patients, all girls. They were like 14, 18, and maybe 21.
Okay.
And the 14-year-old came in one day. It was in the summertime for some restorative work. And I noticed she had like tattoos down her leg. And I was like, oh man, this kid's 14. I don't know what she wants to do as a career someday, but that could be a problem, right? And this is like years ago. Tattoos today, everybody's got a number of them.
Right.
And so like 2 weeks later, her oldest sister, this is summertime, comes in for some treatment, and she's sitting in my chair, and she was wearing a tube top. And I said, so guys, I saw your younger sister. I was kind of surprised, quite frankly, to see these tattoos down her leg. And then, not thinking very clearly, I said, because she seemed a little offended, right? I could tell something was wrong. And I said, oh, so where's your tattoo? And she looked at me and then pulled and I immediately turned my head, and I'm thinking like, I cannot believe I just said that, and my assistant is sitting there, her jaw dropped, and I don't know. I get up and leave the room like I do not know what to say.
Out of here.
But come back in. I'm coming back in when she's got a bib on, and we're not going to talk about tattoos. And I've never asked anybody ever again where their tattoo was, because if they have one, they're going to show it to me.
That deserves a clap. Thank you so much for sharing that story. Oh my God.
That's good.
Oh my gosh.
That
It is so
good.
amazing to have seasoned dentists in the audience.
Yes.
For that right there. It was worth it.
Those are
you
classic
guys.
stories,
Yes.
right? Like,
Oh my God, yeah,
That was
for sure.
amazing.
But these are scary and difficult situations and funny, some of them.
Yeah.
But I mean, we definitely, as you said, we need to have the skills to bounce back and keep
Absolutely.
coming back to
Yeah.
work, right?
Yeah.
yeah.
You cannot be
That or the alcohol.
crushed by this.
That or the alcohol.
Sure.
We're going to cut that one. Maybe not.
That's right.
Yeah.
So have you guys received any important advice to help you manage or recover from these sticky, difficult situations and go on?
I think meeting people where they are, right? I think that's important.
My goal. That means that.
Yeah, so I think that understanding that people have a lot going on, that people have a lot, they make mistakes too, right?
Sure, yeah.
And I think that just meeting people at a very safe space to say, hey, if you mess up, I own that. Like, if I nick the tongue, I'm so sorry that happened here. This is what happened. This could happen here.
Yes.
Properly informing. So meeting people where they are, and then psychologically not trying to overextend yourself when people are somewhere that you're not.
That
right? With the cow
was it.
situation.
Yeah.
I'm not about to start mooing or even try to justify what's the logic behind
Yes.
that. That is something that person is dealing with, and we can move on if it's related to teeth.
Yeah.
I also am a big proponent of, if something is scary and not related to something that I've done, but something that they're bringing in, we have to think as healthcare providers that we are providing a service.
Yes. Okay.
Right?
Sure.
And so what I mean by that is that it is a pleasure for me to work on you. And it is my responsibility to take care of you.
Yes.
However, I don't have to take on anything that I don't want, any type of behavior that's inappropriate.
Correct.
Very right.
Right? And I think that we forget sometimes of being people of service that, we don't have to accept everything.
This is
when you
so
feel like
good.
things are happening to you and it's, disrespectful or not in a place where you can't meet that person mentally, It is
and
okay.
they make you feel uncomfortable, right?
It's okay to let them go.
Yeah.
It's okay to say that I'm not able to serve you. And I want to empower more doctors to feel that way, that you got into this to be of care, of help.
Yes.
And I serve purely from that. What means that I do that with all the love in my heart. If my patients can't meet me with that same type of love back for what I'm doing
and
as
commitment,
service and commitment,
reciprocated.
we may not be.
Yeah.
We're the 95 that doesn't belong together.
Yeah.
Okay? We're the 95.
The 95. Well, last question. What was the most unexpected or surprising bit of good advice you received when you were in the middle of a hard situation?
It's called practicing dentistry.
Love it. Yeah.
Right?
Yeah.
We are practicing every single day.
Yeah.
Every day I'm getting better. It is literally practicing.
Yes.
And so when I take it from that perspective of some days at practice, I crush it.
Yeah.
I'm killing it. I'm successful at practice. And other days, I may not be the best.
That's right.
I love
And that's okay.
That's okay.
It's okay.
Yeah.
Because every day, Michael Jordan didn't have the best day.
Correct.
Whoever you follow from us, like every day is not 100%. I do my best to be 100%.
Exactly. We strive for perfection.
Correct.
Yes.
But it's okay on those days that I don't. And for the crown that didn't sit properly and I seated it, and then I see them 6 months later and I'm like,
Yeah, like who said that?
what day was that
Yeah,
done?
I know.
Right?
Yeah.
I have no problem of redoing it
Yes.
at no charge. I own it. I don't like how that sits, and I'm a person that wants it to be better,
Yes.
right? So I think understanding that you practice dentistry every day. That's the best advice the doctor gave me, and I said, from that moment on, I understood that.
I love that.
And I think
so
it's
much.
really important to, having said all this, and it's very important for us deep in our core to think about, all these feelings, all these, small failures, difficult, sticky situations will pass.
Yes.
And 10, 15 years
Yep.
from now,
Yes.
you won't even
Yep.
remember.
Yeah.
Unless it's somebody showing you their...
Yes.
This you remember.
Yeah, right? I know.
That's unforgettable.
Yeah, he's not gonna forget that ever.
That's unforgettable.
I was gonna say one of my mentors gave me some pieces of advice just to celebrate the wins.
Yeah.
Because oftentimes we focus on what we perceive as failures or losses or things where we need improvements, but find a win and celebrate that. And I think that
Completely
does us
agree.
all good. You know what I mean?
Completely agree.
Yeah.
We're way too hard on ourselves in this industry, and I love that.
Yeah.
We have to love on ourselves, because if we don't do it, as RuPaul says, if you don't love yourself, how to love anybody else? Yes, okay? For all my drag queen fans, okay?
On the next Dental Soundbites.
We're diving into solutions tailored specifically for dental students and professionals. Strategies, tips, and resources designed to help you plan for and conquer the financial challenges that come from launching your dental career.
It was so nice having you here.
Thank you guys for having
the
me.
dialogue, amazing. I learned a lot.
I think that scary situations, you guys have made them less scary. You made them cute.
Yeah.
Fun, right?
Scary, creepy situation. That was creepy.
Yeah, I know.
So we thank you so much, Dr. Ellis. It was great having you here.
Thank
we
you,
learned
guys.
a lot.
I love being on.
Enjoy the stories.
Appreciate you guys are doing an amazing job. So thank you for continuing to promoting that information.
Your whole profile with coaching and social media presence, this is amazing. Very energizing.
Thank you. I don't know when I'm sleeping, but it won't be today.
Yeah. Thank you so much.
Thank you to the audience also.
Thank you to the audience.
They were generous and they brought up so many nice stories. Yay.
Awesome.
If you like this episode, then go ahead and share it with a friend or with a colleague. Then for sure subscribe to our podcast.
Hit that button.
Wherever you're listening. Yes, hit the button. So you can get the latest episodes.
Yes. You can also rate and write a review and follow us on social media.
And don't forget the conversation continues on the ADA member app, the best app.
Thank you for joining us. Dental Soundbites is an American Dental Association podcast. You can also find this show, resources, and more on the ADA member app and online at ada.org/podcast.